we're going to take just 1 minute so that people can hear from the beginning. This information is so vital and so important. I want every ear to hear it. And I see people are still logging in at a fairly rapid clip. And so right around 7:05, which is 2 minutes from now, we'll start. When the rate of individuals coming into the room slows down. We're so grateful to God that He has positioned us with great minds and people who've committed their lives to patient care, and those who are on the front lines. They have perspectives that we don't have, not just clinical perspective, but they see things from their vantage point that we don't see. And so I believe that we're going to be educated tonight, but I also think we're going to be equipped spiritually so that we can do what God has called us to do. I sense that way down in my spirit. And so I'm so grateful to God that this is possible. 1 minute, and we will get going. Welcome to those who are still joining.
Facebook Live audio streaming.
Sounds like Facebook Live is opening up now also. And so for those of you who are here, I want to welcome you to this evening's COVID-19 panel discussion. We have an august panel of very experienced individuals who are on the front lines warring against this pandemic. And we are in a position where we can listen, we can learn, and we can ask questions. We have people in our congregation who have tested positive, and many of them I've been in contact with, and I've seen the hand of God working in their life. And so we want to make certain that on tonight, you get your questions answered. And if time doesn't permit for all of the questions to be answered, we'll think about doing this again. We want to be a blessing to you in this sense. And so one of the reasons that we are doing this is because we're in the midst of a pandemic that we have never seen in our lifetimes. And perhaps the world has never seen, the way it's sweeping the world. And almost every nation on earth is at a standstill. We're now in a conflict between what do we do for local and national and global economics. And there are those who are suggesting that the trade-off between our way of life and life, that the choice ought to be our way of life. And to me, that dishonors the God who has given us the single greatest gift that we all have in common, and that is the gift of life. And we ought to value that and treasure that over all else, because we exist, we live and move and have our being because of Him. And so when we get to the point where we have to make decisions around when to open up and when to move about freely, we want you to be armed and equipped. And tonight is in part about that, so that we can make good personal decisions, we can make good decisions as a church as we care for others. And so now I'm going to pray and open the meeting and give it over to our moderator, Sister Karen. Our Father and our God, we thank you for the privilege of being around this table tonight with those who you prepared for this hour. We thank you for their lives. We pray that your hand would be upon them, protect them, be a covering for them, and tonight touch their mouths. Let their tongues be dripped with truth. God, we thank you for the knowledge that is in them. Speak to them as they speak to us. Help us to understand. Touch our minds and our hearts, that we would receive all that you've prepared for us tonight. Your people will not perish because of a lack of knowledge, because of the knowledge that you've put in them. We receive it tonight. Bless us now and make us a blessing. In Jesus' name, amen. I now hand it over to our moderator.
Thank you, Pastor Oliver. My name is Karen Perrin, and I provide leadership to the Health Team Ministry. And I would just go over the format for this evening's meeting. We have a wonderful list of panelists, many healthcare providers that are from our local body. And I will give a brief introduction of each of the panelists prior to them giving their brief overview. And once the panel discussion has been completed, we will then enter into a question and answer session before having closing remarks in prayer by Pastor Oliver. So I will just begin with giving an introduction on our first speaker. That's Dr. Wilbert Warren. And he is an internal medicine specialist in Philadelphia. He has his own medical private practice, which is Philadelphia Health Associates Adult Medicine, and he's been a physician for over 20 years. He will be speaking on new symptoms presented in COVID-19 patients. And Dr. Warren, I'll hand it over to you.
Thank you very much, and welcome everybody. I'm gonna, as Karen said, I'm gonna give a brief overview of what COVID-19 is and new symptoms and what we need to continue doing to prevent this disease from spreading. Just a background, coronavirus has been around for many years. We know that there are a group of viruses that infect both animals and human beings. And as it stands now, we know there's 7 coronaviruses that infect human beings. And the most recent one is the one that causes COVID-19. COVID-19, as we may all know, stands for Coronavirus Disease 19 because it was first diagnosed in December 19 in Wuhan, China. History, as you know, is that now it involves over 200 countries, a global pandemic. Now, COVID-19 is a respiratory illness. It's a respiratory disease, primarily, which means that transmission is through droplets that's released by coughing or sneezing among individuals. Therefore, if someone has COVID-19 and therefore coughs, sneezes, or even breathes in an area that could be contacted by other people, then the virus can potentially spread to others. We do know that the majority of individuals with COVID-19 have mild or no symptoms at all. We believe that there are many people with COVID-19 infection that are asymptomatic. They feel fine, they go along their merry way, and they don't know they have it. About 15% of those with COVID-19 can get severe disease, requiring hospitalization. And about 5% of those will get critical illness, leading to ICU, intubation, ventilation, usage, or even death. Now, a lot of what we know about COVID-19 today is based on past experience with the flu, with the SARS from 2003 epidemic, as well as with MERS, the Middle Eastern respiratory syndrome occurred in 2012. So we're still learning a lot. So that's the reason why a lot of the major ways we do now to control the virus is through social distancing. But before I get there, initially when we were first told about COVID-19, we're told that the major symptoms are what? Fever, coughing, dry cough, which means that people experience a very deep hacking cough, as if they want to basically put their hand down your throat and pull out whatever is there and just can't come out. It's day and night, dry hacking cough. And as the disease progresses, they may become short of breath. Now, as time passes and as we deal with patients day in and day out, we learn that there are other symptoms that are not as common, but they are present. For example, people may get a sore throat, a massive headache, body pain, feeling hot all over. So when they touch themselves, their body, front and back, is extremely hot. They may also experience loss of the sense of taste and smell. That could be the only symptoms they experience from COVID-19 infection. Some people may also have diarrhea as part of the syndrome. We believe that the incubation period, which is the time from exposure to symptoms, that could range from 2 days to 12 days in the majority of people, hence the 14-day self-quarantine. We believe that as the disease progresses in the individual, the majority of the main time they're infectious is a couple of days before they get symptoms to about 5 days after symptoms begin. After that, the amount of virus that lives in their nasal passages or in the back of the throat become less and less. Therefore, there's a less burden to pass on to others. Within, let's say, 10 to 14 days, a lot of people started to shed the viruses in their stool. We're not sure whether or not if someone has contaminated stool on food or utensils, whether that could be passed on to other people. But that's the reason why we also need to make sure we wash our hands with soap and water at all times. So let's talk about treatment. We know there's no treatment. We know there are studies currently going on to find the most appropriate way to treat COVID-19. They're working on vaccines, they're working on antiviral medications, what have you. But the best things we could do is to, one, continue the stay-at-home orders issued by the government, to wash our hands with soap and water. That's actually one of the best tools, is soap and water. Why? The virus is actually coated by a fat layer. Soap does what? Soap destroys fat. So when you wash your hands with soap, soap kills the virus. Of course, water washes it away. So it's very important to do that every time you come into the house, handling things outside, the mail, groceries, wash your hands with soap and water. And of course, when you're in public, wear a mask. A mask protects others from you and much less you from others. But wear a mask or some kind of covering over your nose and your mouth when you're out in public. And when you're home, make sure you just sanitize things that you touch on a regular basis to protect you from self-infection as well as others. People sometimes ask me, when they say don't touch my face, does it mean that don't touch my face? You're gonna touch your face. Everyone touches their face, okay? The issue is not touching your face, the issue is touching your face with dirty hands. So if you wash your hands thoroughly with soap and water, you could touch your face, okay? So that's all I'm gonna say for now, until it's time for the Q&A part of this presentation.
Thank you, Dr. Wilbert. Our next panelist will be Dr. Kathleen Christophe. She's an obstetrics and gynecology specialist and provides care to COVID patients at a field hospital sponsored by the Department of Health. She's currently being certified in Ayurvedic medicine, which is a holistic integrative medicine with a strong focus on prevention. She's been a physician for over 20 years.
Hello, everyone, and thank you for allowing me to participate this evening. I'd like to expand on what Dr. Wilbert just said, and in addition, I will go through a graphic design diagram on the various organs that are affected in this disease process. In conjunction with that, I'll also discuss my experiences providing care for patients with this illness as we go through this. So we'll start with a screen share. Okay. So I'll just go through systems. So for one, we know that COVID-19 affects the brain. Well, let me start with the background. The ACE2 receptors that we're hearing about in the news, acetylcholinesterase receptors, are the receptors that generally bind to this virus. And when the virus binds to this receptor, it allows it to get into the cells, and that's how it replicates and does the infection. There are these receptors throughout the body. The brain is one area that has these receptors. So patients actually get exposed to this virus through their brain, usually by the nose. There is a saying that the nose is the gateway to the brain, because it actually is. It forms a direct entry inside to our brain. So some patients may end up with strokes, seizures, confusion, and brain inflammation, such as meningitis or encephalitis. So meningitis is actually inflammation of the brain and the spinal cord, which we see here depicted, or if it's just of the brain itself, it's encephalitis. And the only symptoms these patients may exhibit, for instance, with meningitis, is headache and a stiff neck. And with encephalitis, it might be just a severe headache. And they may also display some evidence of confusion as well. Strokes, we know, is basically when the blood supply is disrupted to the brain. So then actual part of that brain may die. And I'll talk some more about that a little bit later. With the eyes, some patients may end up with pink eye. You know, the inflammation of the lining on the upper part and the lower part of our eyelids. They may have some drainage, some tearing, discharge. That is all conjunctivitis. And they may be passing on the virus just from that one site in their body. The nose, as I discussed before, there's a direct entry of the virus through the nose into the patient's body, and they may lose their sense of smell. They believe that the virus actually can move up through the nose's nerve endings and actually damage those cells in there. So the patients end up complaining that they can't smell as well. With our lungs, which we know is one of the primary targets for this virus because it is a respiratory virus, the main endpoint to our lung passageway is the alveolus, which is like a bubble or an air sac. So what they did here is like cut it in half so you can take a look at what happens when this virus gets infected inside the alveolus of our lung. So again, the virus will attach to the receptor. It damages the lining inside. The tiny little teal bubbles inside are the actual virus inside the alveola or the lung cell. And when it's inside, it triggers a whole immune response. The body senses that something is going on. We have an invasion here. So it starts the immune response. And in doing so, you start having a lot of mucus, fluids, and a whole inflammatory response which occurs. So initially, what happens is the patient may end up with the symptoms of coughing. If it gets severe enough, then you have pneumonia, and so this is really what pneumonia is when you have this infection. On chest x-ray, typically the whole lung is supposed to be black, but when you have an infection, it's white. So you'll have patchy areas of whiteness on both sides of the chest x-ray, or sometimes it's being described as a glass ground appearance. So it can have either or. So that's pretty characteristics. The patients, again, start having difficulty with breathing. They may complain of shortness of breath. And what we've noticed is oxygenation really gets diminished, obviously, because they're having difficulty with the exchange of air. But what we notice to be interesting, and I have experienced it myself, is that the patients seem to not really, after a while, understand or acquire the sense that they really have a low oxygenation. The thought is that the brainstem, which is the back part of the brain around here connecting to the spinal cord, is actually depressed by this virus. And what happens is patients are walking around with the oxygenation saturation level really low, 70%, 80%. Normal oxygenation for a healthy human being is 95% or above, which basically tells you how much percent of oxygen is dissolved in your blood. So patients who have this virus and have this depression of their brainstem don't get the sense that their oxygenation is low. And this is pretty critical because at this point, these patients, you ask them, and I've experienced it, ma'am, how are you feeling? I feel fine. They are not sitting up gasping for air as a normal person would. Most people would be panting, sitting up looking for air. No, these patients are laying down, eyes closed, Like I'm trying to get my rest, and when I put the oxygen sensor on, they're reading 80%, 88%, critically low. And they end up having to go back to the main hospital for care. So that's one thing that I would impart to some of you this evening who are watching, that if you have someone at home who has COVID and maybe was not hospitalized and deemed to be in a mild stage of this disease, or someone who's come home after care from being in a hospital for COVID, that is one thing that you can do for them, is actually monitor their breathing, maybe if they're not even paying attention, in terms of the rate. You can just write down a piece of paper, you know, what their normal rate is. For a healthy human being, we breathe at a rate about 12 to 20 breaths per minute. 20 is on the upper limit. A COVID patient, you're figuring they're recovering from a respiratory infection, so about 20 breaths per minute is acceptable, or even 22, low 20s. But once you start getting into the 30s, the 40s, 50s, there's something going on. That person needs urgent medical care. So just something to take home with. Heart and blood vessels. So again, we know that this virus likes to affect blood vessels and the linings of the blood vessels, as we just saw with the alveoli. It also does the same with the other blood vessels throughout our bodies. So again, it likes to attach to those ACE2 receptors and to the cells, just as we see here, and it starts to replicate. So this is the blood vessel. These are your red blood cells, and it does so much damage with that immune response. Here now we formed a clot. Now, depending where that clot is, now there's going to be decreased or no blood flow to the organ it would supply. So if we're at the heart, so now you've got a heart attack. If you're at the brain, you have a stroke. If you're at the kidneys, that's when you're in renal failure. And many patients have required dialysis as a result of this virus as well, because of this. And also, let me not forget, if it's in your lungs, then we have what's called pulmonary embolism. Short, we call it PE in the medical field. That is a very critical condition as well, because if there's no oxygenation to the pulmonary vasculature, blood vessels, obviously there's no oxygenation to the rest of the body, and you can die. It's very fatal. Unfortunately, with this virus, that is one of the main complications, and it apparently was not discovered till about later into treating the diseases that this was a complication for many patients. So more than likely, a lot of patients we lost early on into this epidemic was because of multiple clots, multiple PEs that were occurring in the bodies, and we just didn't know and wasn't picked up. The liver, one of the master organ in our body, which is important for detoxification. Oftentimes the enzyme levels, we check the enzyme levels to see the liver functioning if it's in a healthy stage. Many times those enzyme levels are increased, indicating that the liver is overworking and is having some difficulty. The immune system at this point, with fighting the infection, is in overdrive. And then we give medications to fight the virus, and many times they're being processed by the liver, and then that causes the liver to work even harder. And then not to mention if the patient's already on their medications even before they were sick, which is probably being processed by the liver. So the liver is working really hard, and it's at high risk with this virus just because of the nature of what it does. The kidneys, which we know we have a pair of, which are also important to some extent of the detoxification process in our body, also in making urine, also important in regulation of our blood pressure, also often is damaged with this virus as well, and increases the mortality and mortality for these patients. The virus can either attack the kidneys directly, or the kidneys fail as the blood pressures start to drop, which can often happen with mechanical ventilation, or again, as I said, the brainstem may fail, and that's also responsible for blood pressure. So various things can be happening which causes damage to the kidneys, and the patient ends up needing kidney dialysis, renal dialysis. The intestines, believe it or not, are very rich in the ACE2 receptors. And some patients just present with just having diarrhea initially into this disease process. Many patients, don't even have much of the other classic symptoms. The fever may not come till several days after. They may just have some diarrhea and then walking around thinking probably I ate something bad, when actually they've been infected by COVID. So that's another point to keep in mind, that if you have a new onset diarrhea, sometimes it's associated with vomiting, sometimes it's not, and nausea, that you potentially may have the COVID virus and that you should be tested. Okay. So essentially, these are the main organs. We can go back to the main screen. Thank you. So essentially, these are the main organs that are affected with this virus. I'd like to briefly discuss with you and share with you the various means of boosting one's immunity, because at this time, this is really what we need, not only to be proactive right now, but something to take with us indefinitely. If there's anything that this virus has shown us, is prevention is the key. And learning these preventive measures and taking healthy, active steps to keep ourselves healthy and our families healthy is the best way to contain, such that if we were if we ever had to undertake such an issue like this later on in the future, we'd be better prepared. So the first thing I definitely say is staying spiritually connected is very important. During times of uncertainty, we can always find peace when connecting to our Creator, enhancing our gratitude and positivity. All of those things help to boost our immunity. Meditation, there are various forms of it. I personally practice transcendental meditation, which has actually been backed by the NIH with grants, and has been shown to decrease hypertension, anxiety, insulin resistance, and is actually very effective and being used in Chicago and New York schools. I'll be happy to share with anyone more details if they're interested later. There are also apps which help with meditation, which can be downloaded and you can carry it with you at all times. Several ones are Calm, Headspace, Stop, Breathe, and Think, and Insight Time. So overall, we know that meditation reduces our cortisol, which decreases the inflammatory response and also boosts the immunity. 3, adequate sleep. Get a routine in place. Try to get to bed at a decent time. Usually about 10, latest 11 is usually pretty good for most people, allowing at least 7 to 8 hours of sleep for an adult. We know that sleep deprivation increases your pro-inflammatory response, increases your cytokines, which decrease your immunity. And there's also a possible link with sleep deprivation to cardiovascular disease. Avoid or limit alcohol consumption. And if you choose to consume, get organic-based drinks that avoid the pesticides and the sulfites, which may cause many of the harmful effects and even increase cancer risk. Smoking. If you've considered quitting in the past, this is a good time to do so. You can purchase your aids at your local pharmacy or even have your provider prescribe aids to you. Smoking cessation hotlines I found with my patients have been very helpful and successful. They're open 24 hours. In addition, you can substitute the smoking with another good practice. Meditation has been helpful in that transition. You can do things such as exercise, get a new hobby, especially with using your hands, whether it's crafting, knitting, woodworking, making repairs in the home that you've been putting off for a while. We know that smoking overall causes damage to the blood vessels and the inflammatory process gets stirred up again. And then there's damage to those neighboring tissues as well. 5th, eat healthy. Eating plant-based meals is supported in the Word in Genesis 1:29-30. Avoid eating red meat, but if you try to limit it to once a month, that's great. And if you do eat red meat, I would highly recommend getting grass-fed beef. We understand this time, right now, many people don't have control of their diet, of their food. This is a very difficult time. Some can't even purchase the meals that they normally would. or dependent on others to provide the meals for them, that is definitely taken into account. But if you can't afford fresh vegetables, even the frozen vegetables are fine that have to be cooked. If you can avoid pre-packaged foods, that would be best for one's health. Stay well hydrated. All of these actions or biochemical reactions that happen in our body depend on water. So if you stay well hydrated, you can assure that the immune system is enhanced because it has all the medium to do what it needs to do. Try to eat your daily fruits, your servings of 3 to 4 fruits a day, servings of fruits a day. Your highly favored fruits are your berries, your blueberries, your blackberries, your raspberries. Those are even good for your diabetics. And they neutralize the free radicals in your body, which can prevent a lot of diseases, including cancers as well. We know that strong digestion leads to a strong immunity. So there are many superfoods that add immunity that I like to mention that have antiviral activity, such as oregano, thyme, raw garlic, and roasted garlic, and sage. 2 well scientifically studied herbs that I use practically daily to keep my immunity up is ginger and turmeric, and I have them here to show you. So most of us are familiar with ginger, and some of us are familiar, some may not, with turmeric, but it's becoming increasingly more popular. I've cut open one end. So it kind of has an orange yellow hue on the inside. This turmeric and ginger are actually cousins made from the similar family. And actually they have great benefits health-wise. And
Excuse me, Dr. Christophe, I am terribly sorry to have to interrupt, but just because of time constraints, and there are other panelists, if you wouldn't mind bringing your overview to a conclusion.
Sure. I'm actually towards the end, actually, so good timing. So actually, with ginger, it's considered a universal medicine. It includes a strong inflammatory response. It stimulates a good digestion, prevents nausea, and helps with prevention of cancer and muscle pain. With turmeric, like I said, we discussed also strong inflammatory as well, antiviral, and actually good for depression. There have been studies, and actually in a 6-week period was just as effective and against Prozac. The key with turmeric, though, in order to make it bioavailable in your body, you need to add piperine, which is found in black pepper. So what I usually do is make tea with ginger and turmeric, let it steep. I'll add the black pepper and the sweetener. And so that way it gets bioavailable. And then lastly, what I'd like to suggest is nutritional supplements. Our food supply is not as nutrient dense as it used to be over 50, 60 years ago when our change in agriculture came about. And so most people are deficient in the major vitamins, vitamin D particularly. But if you are someone that takes multiple medications, or if you're on blood thinners or anticoagulants, I highly suggest you review that with your physician because there are some vitamins, particularly vitamin K, that you have to avoid if you're taking blood thinners. So those are the major points that I want to bring up, and back to you.
Thank you so very much for your overview. Our next panelist will be Dr. Cynthia Warren, and she's a pediatric specialist in Philadelphia at Center City Pediatrics. While completing her residency at St. Christopher's Hospital for Children, she was awarded the Henry W. Baird Award for Excellence in Teaching, Spirit of Inquiry, and Compassion for Patients and Their Families. And she's been a physician for over 20 years. She'll be speaking on COVID-19 in children. Dr. Warren?
Thank you, Karen, and thank you for the opportunity to participate in this panel. So what do we know about COVID-19 in children? Most COVID-19 infections in healthy children are very mild. The majority of children that need to be hospitalized are usually children who have underlying medical conditions, such as pre-existing underlying medical conditions, such as asthma, or heart problems, or any of the diseases that lead to a weakened immune system. With the focus on COVID-19, it is important to remember that there are a lot of other illnesses that require hospitalizations in children. And so we don't want to focus so much on COVID-19 symptoms that we actually miss some of the other symptoms that, that may require medical attention in children. And so it is important as parents and caregivers to pay close attention to all the symptoms your children are having or may have. Dr. Warren, Wilbert Warren, reviewed some of the symptoms of COVID-19. And what I would like to do, because children presents a little bit different than adults do. And so what I'd like to do, spend most of the time doing actually, is to just sort of go over how some of these symptoms that he described, and Dr. Christophe as well, can present in children. We're going to do most of the older school-age children probably have the same symptoms and can discuss it as an adult can. So I'm going to focus more on some of the symptoms that you see in infants and toddlers and preschoolers. One of the symptoms that you can see in addition to diarrhea is vomiting in children. So first, I want to start with shortness of breath, difficulty breathing, respiratory distress, pretty much all the same thing. In an infant, if they're having fast breathing, so they may present by fast breathing, meaning 60 times, breathing 60 times or more. What you may also see is what we call retractions, which is like a sucking in. So the child may be sucking in at under the rib cage in the abdomen area. They may have that same motion in the chest area, also in the above the clavicle, above the collarbone, and also they may have nasal flaring, which means that their noses, they're opening their noses because it's sort of like an air hunger and they're trying to get air. And then one of the other symptoms that you would see is something that we call grunting. And my kids are probably gonna laugh at me for this, but the children, they take a deep breath in, and as they're about to breathe out, they make this sound. So it's almost like, and if they breathe like that, you can hear it and you can see the action. So if you notice any of those symptoms in children, it would suggest that they're having some kind of respiratory distress. And as the symptoms move up, so as it moves from the abdominal area up to the nostrils with the flaring and the grunting, it's the most significant and serious it is. So when we get to grunting and nasal flaring, that's definitely a dire emergency in terms of respiratory distress. The other thing that you may see in children, especially the infants, is difficulty feeding. Now, if any of us have tried to breathe and swallow at the same time, that's almost an impossible task, right? We can't do that. Generally, you stop, you hold your breath when you swallow. You can all try it and you can see. So children who are breathing that fast, they're not able to feed. So you may find that they're very fussy, they're shaking their heads, they really don't want to eat. And so that may be a sign that they're having, especially in conjunction with fast breathing, is a sign that they're in significant respiratory distress. They may also just be very fussy or crying a lot, just constantly crying because they can't breathe and it's very difficult. And another thing to look at is how sleepy and tired they are, because it's very, when you're breathing that fast for that long, you get tired. And so when children start the grunting, and when you notice them just really sort of lethargic and laying around and really have no energy in conjunction with fast breathing, that's another serious symptom, and that one that requires immediate care. Toddlers and preschoolers may have some of the same symptoms. We talked about the retractions and so forth, but in addition, they may not be very active, and those that are verbal may not be able to complete a sentence. So for instance, if they're trying to say something to you they may have to stop after a couple of words to stop and take a breath, and then they do a couple more words and then they stop and take a breath. And so if you notice that, that's another sign that they're having some respiratory distress. In terms of muscle aches, so infants who may be having the symptoms of muscle aches associated with COVID, you may notice that the usual kicking, moving their arms around and kicking, they may not do that. They may not want to crawl. They may not want to roll around, or if they try to, they may start crying because it's uncomfortable and it hurts. Toddlers and preschoolers may sit around more. They're usually running around, sit around more, be fussy. They want you to pick them up and carry them. They don't want to go up the stairs. And when you notice them walking, they may have a limp because it kind of hurts to do the normal pressure on their feet and legs. Sore throat. So an infant may, who's experiencing soreness in the throat, may cry when they try to feed, or turn their head away because it hurts and they don't want to eat. Toddlers and preschoolers may show some discomfort. So if you look at their faces, you would see as they're trying to swallow, they have this pained look on their faces, and they may just totally refuse to eat. So you may get away with them maybe taking a couple of bites, but once they realize that it hurts, the next time you come with food, they would totally refuse to eat. So if you notice that, that may be also a sign that they're having a sore throat. With headaches, it may just be fussiness and crying in the infants, toddlers, and preschoolers. For loss of taste, a child may start eating something, so something that they're accustomed to eating and they love, and then they'll spit it out, or they would say, it doesn't taste good. And that may be their way of saying that they can't really taste it. There is no taste to it. All right, and just quickly, I think Dr. Christophe already, did a great job with talking about boosting the immune system. I'm just going to take 2 seconds to say, to reiterate for children, adequate rest is important. Low anxiety, we know that anxiety can lead to the decreased immune system. So we want to provide a low stress environment for children. Try to make it fun. Try to, have them, do play group. And so virtually, get them outside running around, have them make sure they're eating in nutritious meals. Children who are picky eaters, and we know a lot of toddlers are, it's important to contact their physicians about some supplements that can be helpful, which may also include like taking multivitamins. And then I just want to kind of wrap up by talking about how do you talk to children about COVID-19. It's important to, as caregivers, to remain calm and reassuring. Kids will take their cues from how you react and what you do. Make yourself available to listen to them and to talk. And just some transparency. We all know that especially our teenagers, the parents may not be the person that they would talk to about things. And so that's when we talk about a village. That's why you have godparents. And so when you talk to your children, you make sure that you tell them, I'm here if you have any questions, but you can also talk to me, and then you make your list of people, especially the ones you know that they already have a relationship with. Share your thoughts with those people so that if the child reaches out to them, that the messaging will be the same. Pay attention to what your children see or hear. So TV, radio, online, your phone conversations, the adult conversations in the house. Those things are important because you want to make sure that you know what they're hearing, so you can better help them navigate some of that information. Consider decreasing the amount of screen time, not just for children, but for adults as well, because we do know that if you have constant bombardment of information, it can lead to increased anxiety. You want to provide information that is honest to your children and accurate. And you also want to make sure that it's age appropriate. So you speak and developmentally appropriate for the children. And children like to feel like they're doing something, that they, like they're part of fighting this thing off too. So one of the things that you can do is to empower them with things like washing their hands. So teach them how to wash their hands to fight off the virus. One of the things you want to do is to make sure you keep the nails short, because you explain to them that germs hide underneath the nails. So the kids who do not like to have their nails clipped, that may be a reason. You can tell them you can fight the virus off by cutting your nails, show them how to wash their hands. Most children know the Twinkle Twinkle Little Star, the ABC song. Have them sing that. That's about the little 20-25 seconds. Have them sing that as they wash their hands. And teach them how to cover their noses and cover their sneezes and their coughs, so that and those are all tools you're giving them, because every time they do it, it's a great thing. It's like, oh man, I'm fighting off that virus, and so they get to do that, wash their hands and so forth, and that empowers them. And then last but not least, you want to offer opportunities for, like I said before, virtual play dates with friends, talking, FaceTiming with their friends, offer opportunities to play in the home. If you can take them on hikes or in wide open areas to play and run around, that's great. We try to avoid the play, like recreation centers, because, the play equipment that they can touch and transmit the virus. So wide open areas are great. And that's pretty much kind of what I wanted to talk about children. So I'm done. Karen, back to you until the question and answer period.
Okay, thank you so very much, Dr. Warren. I would just ask our audience, if you have any questions, that you begin to enter them in the chat option, or if you're on Facebook, you can enter your questions on our Facebook page. And I will introduce our last panelist, Miss Allison Gibbs. She's a licensed certified social worker. She's the owner of Therapy Concierge, a mental health private practice with offices in Philadelphia and Mainline. And she's been a therapist for over 15 years. And she'll be speaking on coping with COVID-19 and finding online source support.
Thanks, Karen. So we've spent a lot of time talking about COVID-19 and how it impacts your body, but I want to specifically speak to the mental health aspects of this. And both Dr. Christophe and Dr. Warren did a fabulous job of mentioning anxiety and talking about all of the impacts. So what I would like to do is give you a few tips on some things that you can do to manage anxiety. And all of these things are interchangeable for adults and children. It's just about modifying them to make them age appropriate. So the first thing is limiting your news consumption. I love CNN, but at this particular time, a 24-hour news feed is too much stimulation. So the reality is identifying a news source that you trust, selecting a time to watch the news. So perhaps maybe limiting your news options to twice a day instead of all day, or 3 times a day. That may help you experience a reduction in anxiety. The second piece to this is self-care. What are you doing to take care of yourself? How are you replenishing? How are you incorporating fun into your life? Are you meditating? Are you doing yoga? Are you eating healthy? Are you going outside and taking walks? What are you doing to really take care of you? And not only in the physical aspect, but also your mental health. The third component is routine and structure. A hiatus from work, meaningful activities, a change in our plans, disruption to summer plans, all of those things can be absolutely overwhelming. But the reality is your ability to adjust and be flexible during this COVID-19 is what is going to help you survive, right? And so the way to do this is to create routine and structure. Most of us are working from home. Our work environments have changed. So set boundaries, create a workspace. Limit your work time to only your standard 9 to 5 hours. Although it only takes 5 minutes to send that email, don't send it at 8 p.m. Allow it to wait until tomorrow. With your children, create expectations and structure. I am the parent of a 6th grader. She is home and she has seen all hours of the night, right? So we have had to go back and set some expectations. There's nothing wrong with encouraging kids to strengthen their life skills during this time. For parents who don't have online school in place, there's nothing wrong with encouraging your kids to cook meals, to learn how to clean, to go outside, you know, to work on money management, anything that keeps them occupied. Although the world has essentially stopped, this does not have to be an idle time. It's really about how you use it. The next thing I'm encouraging people to do is really to turn can'ts into cans. This is a time where, again, everything has stopped and we are somewhat limited in what we can do. But what I would encourage you is that the limitation is only in how you see the situation. So a wonderful example, gyms are closed. For those people who love to go to the gym and work out, that is not something that's available to you, but there are other opportunities and ways that you can still get a workout. Walk in your neighborhood, go for a jog, you know, go bike riding, pick up some old habits, get active with your children. All of those things promote physical wellness. Next, let's talk about the practical, right? So this is the part of, in order for one to be mentally well, all of your basic needs need to be met. So this is the physiological. So it's your safety, food, shelter, bill payment, all of those things. Money has, you know, stopped for some people. Money is a concern, and that is a real thing. And it is hard to have a positive attitude and hold on to, you know, positive thoughts and mindset when you do have realistic worries. So what I'm encouraging people to do in this time is to call your creditors, call your bill collectors, call the electric company, the water department, and make arrangements. Everyone right now is experiencing a disruption in their income due to COVID-19. So the reality is companies are making arrangements in ways that they have never done before. So feelings of shame, guilt, and embarrassment, you don't have to have those. You are not the only person in this situation. It would be far better for you to make those calls now than to wait to do those things down the road. I promise you, companies are offering forbearances for all types of things. So I would really encourage people to get involved. One of the things that I've done is put together a resource list. And if we are able to put that up, on the resource list, there are things such as food resources, where to go to find a food pantry, how to identify food resources and supports in your community, how to access mental health support. So if you or somebody you know is experiencing a mental health crisis, there are national, local, and statewide numbers to call. If you are active in a substance abuse addiction, there are also phone numbers to call, again, nationally and statewide. In addition to also having resources for parents of children who are on the spectrum. It can be a difficult time if you have a special needs child and you need to keep them active and engaged with all of these limitations. So the reality is I identified a few supports that are available to not only parents, but also children. In addition, there are also resources for caregivers. So if you are caring for somebody, caregiver fatigue is real. There's supports on there. There are people that you can talk to. There are tech supports. And the last thing I'm encouraging people to do is to avoid isolation. I know everybody is doing Zoom calls and Zoom fatigue is a real thing, but human connection is essential. One of the key components to depression is isolation. And when people remain engaged and connected, that combats isolation and promotes good mental health and well-being. So I would encourage you to find ways to connect with your neighbors, with senior citizens, and with other people in your community. Thanks, Karen.
Thank you so very much, Allison. Certainly appreciate it. We're going to now enter into our Q&A session, and I realize that we've kind of gone over time, but we do have some questions from Facebook and also from our chat, and we will be going beyond the 8 o'clock time to address some of these questions. Okay, let's see. Our first question is, Should we protect ourselves? And this is a question from Facebook. Should we protect ourselves with goggles as well, since it can get in the eyes? Dr. Wilbert Warren, can you address that question?
Can you hear me? Can you hear? Okay. Yes, so certainly we're concerned that projectile, when someone coughs or sneezes, we know that when someone coughs or sneezes, the amount of droplets could be in the thousands, and a sneeze or a cough could project the substance 100 miles per hour, so to speak. Certainly goggles does protect you. If you want to do that, that's certainly fine, because getting the virus in the eyes is an entrance into your body. So I wouldn't say you shouldn't or you should, but I don't think it should necessarily be a general policy for everyone to do or necessary to do.
Okay, thank you so very much. Dr. Christophe, another Facebook question. It says, a member's husband was diagnosed in February of this year with pneumonia and hospitalized. He had shortness of breath, a bad cough, and she was wondering if he had COVID-19 back then. He's doing better, but remains under a pulmonary doctor.
You're saying this occurred in November 2019, correct?
Say that, she was
November 2019?
February of 2020.
February 2020.
The member's husband was diagnosed with pneumonia.
It's a possibility. All we know is that we have antibody testing on their way. The validity of those testings will also be looked at. So it might be reasonable for that person or even the household to go to get antibody tested to see if they have been exposed to this virus. And that will give them the answer that at least that they've been exposed. And probably that pneumonia period probably would have been the COVID pneumonia.
Okay, thank you so very much. Another question from the Zoom chat is, how does COVID-19 affects Blacks differently? Dr. Wilbert Warren, can you take that?
Okay. We know that there's disparity in healthcare when it comes to Blacks, whites, Asians, and a lot of our Black population suffer from pre-existing conditions, diabetes, high blood pressure, heart disease, kidney disease. And these diseases in general weakens their body. Dr. Christophe talked about the immune system. And when you have diseases that affect your body overall, it reduces the ability to fight off an infection. So when you get something like COVID-19 and it demands a strong immune response, when your body is already weakened by pre-existing condition, it's harder to fight. Therefore, those patients, particularly Blacks who suffer these conditions, are more likely to succumb to the virus infection.
Okay, thank you so very much. The next question is for Dr. Cynthia Warren. This is from Facebook. How do you think the children will cope with wearing masks as they return to school? Do you think the fall is a good time for our Pennsylvania students to return to school?
Well, you know, in terms of the face masks, it's recommended that all children over 2 wear a face mask. Obviously, if the child is developmentally delayed and they have difficulty with that, then you probably have to find an alternate way to cover the faces, maybe something that's not as restrictive. In terms of going back to school, I mean, really that's going to be depending on what happens in the next couple of months and based on what the recommendations are from the health department based on what they're seeing in our region at that time.
Okay, thank you so very much. Let's see. A Facebook question for Dr. Christophe. The question is, would like to revisit herbs for building the immune system. What are your thoughts on oil of oregano and black seed oil?
Oil of oregano is well known to be very high in antiviral activity. So definitely highly recommended as far as that is concerned, and the actual fresh herb itself and cooking with it. Black seed oil, I don't have much experience with, so I could not give you information on that, unfortunately. But I will say that other herbs such as thyme are also beneficial, sage. All of these have high antiviral activity. And then there's a whole list of others which are probably not as well known in the Western culture, and I'd be happy to discuss with someone in a private conversation.
Thank you so very much. And there might be participants who are just on the phone who might have a question. If you select *9, you can raise your hand.
Good evening, Sister Karen. You do
Yes.
have other questions that are appearing on the chat now. There are 3 new questions that have appeared on the chat.
Thank you. Okay, this question is for Dr. Wilbert Warren. With all that this virus does to one's body, would you please explain to me how it is that a person can have this virus and go into remission and no longer have it?
Okay, think of the flu. Someone gets the flu, your body deals with it, and you get over it. Or the common cold, which we get often. Your body, you get the cold, your body is able to ward it off, and you recover. So just like any other virus, if you have mild case, your body is able to mount the appropriate immune system without overwhelming the system and getting significantly sick secondarily to that, and allow you to recover. So it's believed that after the infection, you have antibodies to protect you. And just to add to that, what we don't know is whether or not the antibodies that's produced through the COVID-19, whether it gives long-term protection.
Thank you. Another question from Facebook is, how does hypertension factor into COVID-19? Dr. Christophe, can you take this question?
Well, with hypertension, we know that there's usually underlying cardiovascular disease or even maybe coronary artery disease. And all of those factors increase your risk for having damage to the cell walls of the lining of the blood vessels and also the linings of the blood vessels of the heart. So when you already have a pre-existing condition as hypertension, what that really means is now the heart is working much harder to pump that blood to the rest of the body. And in doing so, it's acquiring many other inflammatory responses, and in that gives you that increased risk of having issues with any viral infections.
Thank you. And Dr. Kathleen, I have another question for you from Facebook. Do you use the turmeric root, or can it be the powder in the spice aisle?
I use the turmeric fresh, and I grate it, but you can use the powder. The powdered form, which is sold, is just basically the grated herb, which is dried. Both forms are perfectly reasonable. I would prefer either of those forms rather than the capsule.
Thank you so very much. Another question is, we understand that Governor Wolf is in the process of lifting restrictions. Do you think it's a good time to do so? And Kathleen, you can address that.
Well, I think that right now we're in a situation where they're still looking at the amount of deaths that we have daily. I think that unfortunately, without having ramping up the tests, which they're about to do so, without having those numbers of how many people are actually infected, makes it more difficult to make that decision. And I think that's one of the things that he's considering, and that's why there's been a pushback also in the date for reopening. So I think all of those issues are a factor in actually deciding on the safety of opening up.
Thank you. And I believe Dr. Wilbert Warren would like to make some additional comments to that question.
Actually, what I wanted to make an additional comment about the high blood pressure.
Okay.
And just to underscore that high blood pressure is more than just a number. And the reason I say that is because I have many patients who tell me, well, my pressure is controlled right now, the medication, do I need to continue it or not? Can I just stop it? Now, high blood pressure is a systemic disease, like Dr. Christophe was saying, in talking about all these receptors in different organs. When you are taking medication for high blood pressure, yes, it helps to lower it, but high blood pressure causes damage to the kidneys, to the eyes, to the heart, to so many different things when you may not feel those injuries that's taking place. So please do not stop your blood pressure medications. And just one thing, it's been in the news that possibly individuals who are taking ACE inhibitors or ARBs, like losartan, lisinopril, the Prenivils of the world, may be worsening their condition if they have COVID-19. Based on a publication yesterday in the Journal of American Medical Association Cardiology, there's clear evidence that taking Prenivil or other ACE inhibitors or ARBs do not worsen your condition if you have COVID-19. There's a greater chance that by stopping medication, you end up with heart attack, strokes, heart failure, kidney failure, okay? Any questions, ask a doctor, but do not stop your medications. Thank you.
Thank you so very much. I have a question from the chat. It says, if you are not exhibiting any symptoms, should you get tested? And can anyone 65 and over get tested due to their age without symptoms? Dr. Wilbert, you want to take those two questions?
Yes. Okay. When I talk to a patient on the phone, and oftentimes if they tell me that they're not, if they don't have symptoms, I say, don't get tested. Why? Because nothing's going to change as far as management. Would testing be helpful? Yes, from a policy standpoint, from knowing where to put resources on part of the government. Yeah, we want to know who has it and who doesn't have it. But from an individual standpoint, if you have no symptoms, even if you're exposed and you have no symptoms, there's no need to get tested. What I recommend is to self-quarantine for the 14 days, monitor your symptoms. If anything develop of concern, then you should notify your physician.
Thank you so very much. I just wanted to let everyone know that we will be ending at 8:30. So we do have time for more questions. Let's see.
I have a question.
Oh, okay.
I wanted to know, I'm on the phone, so how would I get a hold of the resource list?
Well, what we will probably do is get your information through a private chat, and we would try to share it with all the the attendees for this meeting.
Okay.
Or, Pastor Wangowi, can you provide better guidance regarding this question?
Yes, if you have access to our website, we will have the information posted by tomorrow afternoon. Additionally, you can contact us at the church office and leave a voicemail at extension 117 if you don't have access to the website, and we will find a way to get you that information. Thank you.
Thank you so very much. Okay, let's see. Sorry. Okay. Okay, we have a question. Is it possible to make an appointment with either doctors? I would imagine they're speaking of possibly Dr. Wilbert Warren and Dr. Kathleen Christophe.
Well, for me currently, I'm working in the, this is Dr. Christophe. I'm currently working actually in a field hospital setting. So there's no office base there. But Dr. Wilbert would be the one to actually be able to manage patients on an outpatient basis. So he would be the one to get that information from.
Okay. Thank you. Dr. Warren, is it possible that the person who asked that question can contact the church to get your contact information?
Yes, that's possible.
Okay, thank you so very much. The next question is actually for Allison Gibbs from Facebook. Do you think fear is a factor and gives a person of defeatist mindset?
Absolutely. Fear can be crippling. Fear keeps people from doing things that they want to do. So the reality is, with everything that's going on with COVID, it is very easy to be fearful. There is a lot to be scared of, and these are actual legitimate things. But through working with a therapist or through a positive mindset, you can see the positives despite the things that are fearful and going on around you.
Thank you.
Really, sure.
Thank you so very much. Another question is, can we, and Allison, I'll ask if you could answer this question. Let me see something. It was in regard to speaking about post-traumatic stress syndrome signs and symptoms resulting from this pandemic.
Sure. So I think because this pandemic has started or is going on and we are still going through it, a lot of the long-term signs and symptoms and effects we are not going to know until down the road, because that's how research works. But I think in just some of the day-to-day things that we're seeing, it's the behavioral and emotional changes in people, changes in your appetite, changes in your sleeping pattern. So all of the physicians essentially talked about how necessary sleep is. When we sleep, our body rests, but our brain cleans itself. And that is very important when you're talking about mental health and the thoughts that you think and have throughout the day. So I think thinking about how to create as many positive supports, how to keep yourself surrounded by positive things will help with the long-term effects of some of the symptoms that we're seeing as a result of COVID.
Thank you. We have a question. Can the kidney restore itself after being damaged due to the virus without treatment? Dr. Wilbert Warren, can you take that question?
Okay. That's really a tough question to answer, only because it depends on the extent of the damage. Certainly, we have seen patients who are acutely ill and have a temporary damage to their kidney function, and over time, it just tends to improve, even back to normal. However, like we said, this is a new disease. We're learning more about it. So it all depends on the extent of injury that we're talking about.
Okay, thank you so very much. Another question, is it true that high blood pressure meds can exacerbate the virus?
I think I just answered that. What was explained by Dr. Christophe is that we have these receptors they call angiotensin converting enzyme receptors, and they're all over the body, brain, kidneys, lungs, blood vessels. And the way the COVID-19 virus works is that it uses the protein on the surface to attach to these receptors and, like a lock and key, open the door to gain access to these cells and cause damage. Now, there have been a concern that individuals who are taking ACE inhibitors or ARBs, like Prenivil, lisinopril, losartan, olmesartan, these medications may cause more of these receptors to be made within the body, therefore possibly allowing the virus to have more access to each cell of our body. However, there was a publication that was in the Journal of American Medical Association journal yesterday that says that people who have had COVID-19 who were on these specific blood pressure medications, they have not been shown to have any worsened outcome. Therefore, the conclusion is, even though we do need to look further into it, is that taking these medication will not increase your risk. So, like I said before, do not stop your medications.
Okay, thank you. Another question is, I heard in the news that the percentage of those contracting the virus is higher for males versus females. Is this true? If so, why?
Well, just, okay, you can go ahead.
Okay.
Yeah.
I mean, just based on what I've read, the thought is that most of these males who did worse with the COVID-19 tend to be smokers, and that's the major underlying problem with some of these males. Some of them have obstructive lung disease, a sleep apnea also, which just predispose them to lung infections.
Okay, thank you.
Mm-hmm.
Dr. Christophe, did you want to add?
No, I mean, generally there's the predilection for males, and yes, those risk factors, there's always that thought that woman or the female in the household takes care of herself more so and is the main person to care for the family. So unfortunately, this is one clear example of, males needing to ramp up their self-care.
That is true.
Okay. Let's see. Another question is, in February, I got the flu shot. I was told to come back in 2 to 3 months for a second shot. Should I go?
It's not clear why they were asked to get a second shot. Typically, it's one dose. So I'm not quite sure. If I can get some more background information, or Wilbert, do you have any thoughts of why someone might get two?
No, I don't. Doesn't make any sense. Flu. Yeah, flu vaccine is only once. But I will say this though, get your flu shot. If you think about it very carefully, if for those who say, well, COVID-19 is not as serious as the flu, think again. In this country, 1 million cases, known cases, okay, with over 60,000 dead people, all right? Last year, 34 million Americans had the flu, 34,000 people died, all right? Just think about that. This disease is contagious, it's infectious, it is deadly, it is not the flu, it is not the flu. The flu can be prevented with your vaccines. It could be treated with antiviral when given in an appropriate amount of time. Get the flu vaccine unless you have a strong medical reason not to get your flu vaccine. It saves lives, it saves lives, it saves lives.
Karen, can I add something about the
Sure.
question? So if you're getting the flu vaccine for the first time, or you haven't had 2 flu vaccines in the same season, then the recommendation would be to get the second one. So children under 8 who has gotten only 1 vaccine, we usually have them come back within, like, at least a month has to go by between both vaccines. So if that question was in reference to a child, that would be the only situation where a second one would be recommended that I'm aware of.
Thank you. Let's see. A question for Dr. Wilbert is, do you think there will be a second wave of COVID-19? And if so, when? And do you predict it will be as strong?
You know what? I'll leave that up to the epidemiologists, the Dr. Fauci's of the world, to let us know that. Nobody really knows. We know the flu, occurs seasonally. The concern is that it may be in a community silent during certain times of the year, and then, rear itself, because just like the flu, when we're in closed quarters, we could see a spike. I don't know, nobody really knows, but that also underscores the reason to get your flu vaccines. Okay, that's all I got to say.
Okay. All righty. Let me see, this will be our last question. Can the virus be transmitted through breast milk? What if a person is pregnant? Can the baby get it? Kathleen?
Currently, we've found that, luckily, most of the patients who are pregnant and have the virus, at least in this country, have not had severe cases. Most times now, what the hospitals are doing are actually doing the testing. If the patients haven't been tested, they test them as they come through the door. And many end up being asymptomatic, but are testing positive. In terms of transmission to the fetus, that has not been an issue so far. There is no thought whatsoever that there is direct transmission from mom to baby, which is a great thing. Breast milk has always been a positive issue. I have not read any indications or anything that discuss breast milk from a positive mom to a baby. I'm not aware of that, but in terms of getting fresh, some women have now offered to give their breast milk, those who are negative and do not have the disease, have offered it to banks for babies who have moms who are positive as an option.
Thank you so very much. For all the panelists, for your overviews, for your questions that you answered. They were very engaging questions from our audience. And thank you, audience, for staying on longer, because I know we were only supposed to, was from an hour meeting. But thank you so very much, and I hope that you benefited from the information shared by each panelist. And I just hope that we will all leave being better equipped and able to make better decisions during this most stressful time. Pastor Oliver, I would just like to thank you for the opportunity for planning this, for the, helping the health team in planning this Zoom meeting. It was a wonderful opportunity to have our healthcare professionals from our body to participate, to provide their medical expertise. And thank you, audience, for all your engaging questions. And I also would just like to thank the church staff for all those behind the scene who worked, just above and beyond in planning this Zoom meeting. I will turn it over to you, Pastor Oliver.
Thank you, and thanks to the panelists. We all owe you a debt of thanks for what you've done to inform us tonight. God bless you, and for what you do on the front lines every day. And know that we pray for you every day at noon. Some of you, we call your names, but we don't cease to pray for you. And we pray that God would continue to cover you and to protect you as you go out to make certain that people have better lives. And for everyone who joined, thank you for hanging in there with us, being patient. We hope that this has blessed you and that this information will be power for you to make good choices for yourselves and for your families. And now may the Lord watch between you and me while we're absent one from another. Go in power and go in peace. God bless you all, and special